Welcome back. I am Dr. Lee's AI speaking assistant in practical pain management. It is one of the videos that show how much rotation and tilting I need to find a target and approach the needle. Please check the cranial tilting and rotation angle in each procedure. I will show you a bilateral L5 transforaminal injection with the help of a contralateral oblique image. The patient underwent an operation of interlaminar fixation devices at L3-4 and L4-5 levels. The C-arm is in a position of AP and 5 degrees of cranial tilting. He is operating the C-arm to the ipsilateral oblique view. The compass shows 20 degrees of left rotation. Let me begin.
It will sting.
I will put the needle in the ordinary puncture site. Usually, I continue to step on the pedal switch to observe the needle movement, which saves time and reduces insertional pain. So, holding the distal shaft of the needle with long placenta forceps will save my hand from scattered radiation. Once the needle takes the right path and goes straight, I switch to my bare hand. I can change the direction of the needle by guiding the front portion of the needle, which is already bent before the procedure. Let me move on medially parallel to the inferior border of the pedicle shadow on AP view. The compass shows 30 degrees of contralateral oblique rotation. We have a few millimeters away from the target. Sometimes I can go to the just inferior to the pedicle, but frequently I cannot follow the ideal pathway. It is close to the ideal target. Always warn the patient of the infusion of the fluid and ask for the patient's feedback. The contrast spread looks good.